day. in the chat box, just your name, where you're from, and maybe your state and the name of your hospital. That would be great. And just a quick reminder, if you can, to mute yourself when you're not speaking so that I can keep the lines open for everyone. So I guess let's get started. Welcome to the Pediatric Disaster Preparedness Quality Collaborative. I'm so excited that you all decided to join us. Just briefly, the session is being recorded, and the recording of the session will be posted to our participants only website. Here's the link, and there's a password for this page. It's P's Disaster Ready. We will go into the web page here in a little bit, and I'll show you around a little bit of what we've designed for you all. First, let's start briefly with our funding acknowledgements and a disclaimer. So the Eastern Great Lakes Pediatric Consortium for Disaster Response is funded by the U.S. HHS Office, Health and Human Services, Office of the Assistant Secretary of Preparedness and Disaster Response, ASPR, totaling $6 million to pilot the creation of a pediatric disaster care centers of excellence to improve disaster response and capabilities for children across the United States. As well, and this is a partnership, the EIC is supported by HRSA of the U.S. Department of Health and Human Services as part of the Emergency Medical Services for Children Innovation and Improvement Center Cooperative Agreement, totaling $1.5 million with 0% finance from non-governmental sources. So the content presented here and throughout the collaborative is that of the authors, of ourselves, and it does not necessarily represent the official views of nor an endorsement by ASPR, HRSA, HHS, or the U.S. government. So a brief agenda today. We're going to start with introductions. We're going to introduce you to our two groups, Eastern Great Lakes Pediatric Consortium for Disaster Response and the EMSC Innovation and Improvement Center. As well as give you kind of a brief overview of who all is participating in this collaborative. We'll go through the aim of the collaborative as well as the structure. So we'll go through the schedule of events, we'll review the website, what's going to happen on the learning sessions, the red cap system, and finally the environmental scan. It shouldn't take too long. I want to leave plenty of questions at the end for Q&A anytime. So about us. So this collaborative is a partnership between the EMSC, Emergency Medical Services for Children Innovation and Improvement Center, and the Eastern Great Lakes Pediatric Consortium for Disaster Response. So to begin with, the Quality Collaborative team is made up of Brent Casney, and I don't think, Brent, are you on the phone yet? You might not be on yet. So Brent is the medical director and Director of Emergency Management at Texas Children's Hospital in Houston, Texas. He's also Assistant Professor at Baylor College of Medicine in Houston, Texas, as well as the Director of the Disaster and Preparedness domain for the EMSC Innovation and Improvement Center. Pat Frost, Pat, are you on the line?
I sure am.
Go ahead and introduce yourself.
Hi, I'm Pat Frost and the Vice Chair for the National Pediatric Disaster Coalition, and I have the absolute pleasure of being the lead for the education work group with the Eastern Great Lakes Consortium for Pediatric Response and a supporter of our quality collaborative here.
Wonderful, thanks, Pat. And Deanna, are you on the phone?
Yep, I'm on.
You want to give me your introduction?
Yeah, so I'm Deanna Dahlgrove. I'm a professor of pediatrics at UH Rainbow Babies and Children's Hospital in Cleveland, Ohio, and I'm a co-PI for the Eastern Great Lakes Pediatric Disaster Response Consortium, which is composed of Michigan and Ohio, and 6 of our children's hospitals within that, along with our public health and emergency management and EMS partners. So I'm so excited that you're all part of this, and I look forward to seeing what great work comes out of this.
Great, thanks, Deanna. And I'm Meredith Rodriguez. I'm a senior project manager with the EMSC Innovation and Improvement Center. I'll be your primary contact for the collaborative, so you'll see my email address here. And please contact me with any questions. And my little disclaimer is I am not a disaster expert. I am a quality improvement collaborative specialist And so I will take your disaster questions and redirect them to all our wonderful experts here. But I am mainly an expert in project management and quality improvement collaboratives. Michelle, are you on the line?
I am. Hi, I am Michelle Megling. I'm the coordinator at UH Rainbow Babies and Children's Hospital for our pediatric readiness across our UH system. And then I'm also the senior project lead for our Eastern Great Lakes Disaster Consortium.
Great, thanks, Michelle. And Dr. Macias, are you on? Oh, I see you can't get the microphone or call to work. So, okay, Dr. Macias is the Division Chief of Pediatric Emergency Medicine, as well as the Chief Quality Officer and Vice Chair of Quality and Safety at UH Rainbow Babies and Children's Hospital. Also an Associate Professor of Pediatrics at Case Western, co-principal investigator of the Eastern Great Lakes Pediatric Consortium for Disaster Response, as well as the Executive Director of the EMSC Innovation and Improvement Center. So let me kind of give you, there we go.
Hey Meredith, I was able to join.
Oh, hey Brent, do you want to introduce yourself?
Sorry, I'm just a couple minutes late. I apologize. But my name is Brent Kasny. I'm a Peds Emergency Medicine doc at Texas Children's Baylor College of Medicine. And I serve as the director of the disaster preparedness domain for the EIIC. And we're really excited to have all of you guys here. I know Pat, Deanna, and Charles and I, as well as Meredith, are really excited to see how this goes and work with you all on this over the course of the next couple of months.
Well, that's what I'm trying to figure out.
Great, thanks, Brent. Okay, so the Eastern Great Lakes Pediatric Consortium for Disaster Response is one of two pediatric disaster care centers of excellence that was funded by ASPR. And so in September 2019, ASPR funded these two centers with a mission to create pediatric disaster care centers of excellence to improve disaster response and capabilities for children in the United States. So one of the centers is us here, and we are located in the Michigan and Ohio region. And I will get into a little bit more detail of who makes up this consortium in a minute, as well as what we call the RAPM group. And so that's the Western Regional Alliance for Pediatric Emergency Management. And that is comprised of Arizona, California, Nevada, Oregon, and Washington. And our two groups work in close contact with each other to with a shared mission of improving pediatric disaster care. So a little bit more about the Eastern Great Lakes Pediatric Consortium for Disaster Response is, well, first off, you may hear it called the EGLE Group or the EGLE Pediatric Disaster Center of Excellence, or just the EGLE Center of Excellence. Those are all the same thing. As we go forward in this collaborative, you may hear this group referred to as that because of Eastern Great Lakes Pediatric Consortium for Disaster Response. Is kind of a lot to say. So the EGLE group is headed out of the University Hospitals, Rainbow Babies and Children's in Cleveland, and it's comprised of 5 children's hospitals across Ohio, Michigan, including Cincinnati Children's, Nationwide Children's, Children's Hospital of Michigan, C.S. Mott Children's Hospital at Michigan Medicine, and the Spectrum Health of Helen DeVos Children's Hospital. And so we have pediatric disaster experts from all of these hospitals who are working on various projects within this consortium, including telehealth, a hospital survey, a national resource map, as well as this quality improvement collaborative. And also the Emergency Medical Services for Children, our other group here, is housed under HRSA, and we are part of a cooperative agreement and 2 national resource centers. So here's us under HRSA, Emergency Medical Services for Children, Innovation and Improvement Center, and MEDARC, which is the National EMSC Data Analysis and Resource Center. And our mission is to support, through grants, 58 U.S. state and territory EMSC programs, the Pediatric Emergency Care Applied Research Network, which specializes in running clinical trials and finding best practices within pediatric emergency medicine, as well as running national quality improvement programs. And this is why we've partnered together with the Eastern Great Lakes Group to run this collaborative. And so Some of you may and some of you may have not have heard of the National Pediatric Readiness Project. We conduct a national assessment every few years where we look at gaps in pediatric emergency care across the nation and then work to address those gaps. The most recent of those projects being the National Pediatric Readiness Quality Collaborative, where we had about 140 hospitals all across the U.S. who engaged in this National Quality Improvement Program to increase the quality of care in different clinical spaces for pediatric patients. So to kind of broadly frame what we do as the EMSC, and I borrowed this slide from the Institute of Healthcare Improvement because I think it does a really good job of encompassing how the EMSC program works to improve pediatric readiness and pediatric care across the spectrum and the continuum of care. So we work at all these levels at both the federal and local and state government levels, as well as in hospital-based care, public health, out-of-hospital care, or what we call our family advisory network. We work in the EMS space as well as in emergency management and public safety. And we do this through several different avenues, the Quality Improvement Collaborative being one of them, so performance improvement. We also work through education and information sharing, as well as engaging providers and communities to really improve pediatric care. So before I launch into a little bit about the participants in this collaborative, does anyone have any questions about who we are and what we do? Okay, great. So as of this point, and we are still actively recruiting hospitals, so if you know of another hospital who would like to participate, you are more than welcome to send them my email address and we will get them engaged in the collaborative. But as of now, we have 31 hospitals across 15 different states, territories, and provinces. And so we have Children's Hospital of Eastern Ontario up here in Canada, and we have 2 hospitals down here in Puerto Rico. The annual pediatric volume at your hospitals range quite a bit. And let me just say with a caveat, this is based on your application data. So a lot of you haven't quite finished the application, which is completely understandable as we got this up and running pretty quickly. But you'll see here I have blank data for about 12 hospitals. So if y'all could go in and into the REDCap system, finish your application data, we'll get a better picture of who's all participating in this collaborative. But as of now, the majority have pretty high pediatric volume. So 9 hospitals with a very high, over 10,000 pediatric patients, 4 with medium and 4 with low, and then 4 with a medium high, sorry, excuse me, and 2 with medium pediatric patient volume. About 8 hospitals are just a generalized ED, so that's pediatric and adult patients are seen in the same area. 5 are pediatric EDs in a children's hospital. So 5 of you are children's hospitals only care for children. 4 have a separate pediatric ED in a general hospital, 1 freestanding ED, and 1 standby ED. So like I said, this will be posted to the participants only webpage, as well as all of the list of hospitals and email addresses for people at those hospitals. If you do not want your name and information shared with the larger collaborative, please email me. By Tuesday next week is when I plan to publish the list of participants. So it'll be behind a password protected webpage. It's not going to be open to the general public, but I wanted to make everyone's contact information available to all participating in this collaborative. So briefly, I guess, well, let me just pause there. Any questions about the participants in the collaborative or completing the application process? Okay, well, feel free to email me if you have any questions about the application process or recruiting more hospitals to join us. So the aim of this collaborative is that by October 30th, 2020, we will collectively improve our pediatric disaster preparedness environmental scan score by 10%. And towards the end of this presentation, I will talk to you a little bit more about the environmental scan. But basically, it is just a series of questions that really evaluate to what extent the pediatric population is considered within your disaster plan. And our goal is to increase by 10% that score by the end of this collaborative. Now, it's a short collaborative. You know, most of our collaboratives, the last one we just finished was 2.5 years long. This one's 4 months. So we're hoping to make some meaningful progress. And that, you know, requires us to all work pretty hard and work together, but I think we can do it. The collaborative is going to be broken down into 3 main areas of focus. Our first set of modules is going to be focused on sort of the internal hospital pediatric disaster preparedness. And so our specific aim within that section is that by October 30th, 2020, at least 85% of participating hospitals will have a disaster plan that includes pediatric specific needs. And we'll get more into the weeds of that as we go through. Specific aim number 2 is regional disaster coalition building. And that is so by October 30th, 2020, at least 85% of participating hospitals will participate in a regional disaster coalition. And lastly, specific aim number 3, patient tracking and reunification by October 30th, 2020. At least 85% of participating hospitals will have a written process for tracking and the reunification of unaccompanied pediatric patients. So I keep alluding to this, so I want to show you this before I go more into the structure of the collaborative. And that is our participants only website. So let me click on here. They'll take you here to the link. And this is the first thing you'll see. This is on the EMSC page. So feel free to click around and explore what else we have to offer. Our password is PEDS Disaster Ready. I'll take you into our webpage. This is for all of you. We'll have our welcome statements. You'll have our aim statement here on the first page. The calendar, which I emailed our IT guys this morning, does not seem to be populating. So all our events are in here. And when they fix the bug, whatever's happening, you'll be able to click on learning sessions, and there'll be a description and a little button where you can add it to your calendar. But for the time being, you can refer to the schedule events, or you can email me for the calendar holds. One note on that, for our remaining learning sessions, I haven't sent those calendar invites yet because I didn't want to pepper everyone with calendar invites without giving you a chance to ask questions about what they're about first. Here will be our participant list. Here's the wonderful map I showed you earlier. And once again, if you don't want your information included on this, please email me by July 14th before I put a list here of all the hospitals. Here is learning sessions. We'll get more in depth on what these are about, but here's all the call information for the learning sessions, as well as the modules. And I'll go through here a little bit more about the modules, but you all should have received the welcome packet from me. If you haven't, you can find it here on the website, and you can click here to download it as a PDF. And as we release the next modules, they will all populate in here as we go through the collaborative. So any questions about the participant-only website, how to access it, and what you need to do?
Excuse me, Meredith, this is Amy Lanuza from Knox, and we're not seeing any slides or anything that you're really talking about. We've tried multiple ways to get on the Zoom and have not been able. I can hear you fine over the phone, but.
Is anyone else having that problem?
I am as well.
Yeah, Meredith, there was, you had to sign into Zoom. And so I don't know if everybody has a Zoom account. So I don't know if that was a barrier to some people.
Okay. Well, so the slides are going to be posted to the webpage later, along with this recording. So hopefully you'll be able to go through and see them later. I'm sorry. I think. So the Zoom sign-in was a problem, I see, Tim. Okay, I'll have to look at that and see if I can bypass that somehow. I know that Zoom has changed some of their security features, but I don't know if that's one of them. But I'll try to see if there's a way to get around that for the next learning session. Okay, so schedule of events. Any more questions? Okay. Schedule events. So we're starting today. This is our official launch and welcome. Next week, we're going to go through the environmental scan. You'll have a week to complete it, and I'll go into more detail on this here in a minute, which should be plenty of time. It should not take you a lot of time to complete the environmental scan. We'll talk about that more. Next Tuesday, we'll come together for our first learning session, which we will go over sort of the role of the pediatric champion. And we're going to address this at several different levels because from the rural and our communities all up to our children's hospital, the role of the pediatric champion may look a little different. And we're going to introduce our first set of modules, which are really going to be focused on how a pediatric champion can engage with disaster preparedness within their own hospital. And so you're going to review your current policies and drill history, as well as conduct a small tabletop exercise through Module 3 at the middle of August to sort of test your departmental engagement and communication in response to a disaster event. We'll come back for our second learning session on August 25th. We'll debrief the tabletop exercises and review the after action reports, and then begin with an introduction to regional disaster coalitions. And that's our second topic, where we'll have several modules in there, including kind of identifying your regional coalition, interacting with key individuals that are part of it, reviewing their drilling history, and the pediatric annex, and we'll talk more about that later. As well as ask for each of you to participate in a virtual exercise that is put on by the EGLE group. And we'll talk more about that in a little bit too. We'll finish off this section with our third learning session, where we'll talk about what happened during the regional drill and virtual exercise, and then introduce our last module, which is patient tracking and reunification. And this will be, we're coming back into your hospitals and really starting to get into the nitty gritty of really improving specific areas that are important for pediatric emergency care. And from our experience with previous collaboratives, patient tracking and reunification is #1. So we'll begin by laying the foundation within your hospital, engaging with the regional coalitions, and then we'll start to really kind of show you how you can improve in one specific area, and then lay the foundation for how you can continue improvements in other areas of pediatric emergency care, and how you can sustain these efforts. Our final learning session will be October 27th. We'll do this, we'll take the environmental scan, kind of give an overall collaborative evaluation, celebrate our successes, and identify common challenges and practices. And just a quick request, if you can mute your phone when you're not speaking, that'd be really helpful. Okay, so before I talk more about the learning sessions, any questions on the overall schedule? Okay. The learning sessions are going to be 5 total. Refer to the schedule events for the exact dates, and after this call today, I will send you all the calendar invites so that you have them on your calendar. These are going to be virtual, and they will also be posted to the participant-only website. So after every learning session, the slides and the recording will be posted to the website. They're going to occur on Tuesdays at 12 Eastern, 11 Central. The general structure is going to be a topic presentation by one of our national subject matter experts, introduction to the next set of modules, and then group discussion, plenty of time for questions and troubleshooting. And once again, if you can attend, the recordings of each learning session will be posted to our website. Now the modules, they're going to be released on the first Wednesday of every 2-week session. So you will get an email from me, and they will also be posted to the website. And the modules, you will get a module packet, which will include an introduction and background, and then a short series of tasks to be completed and answered in the REDCap system. They're not super involved questions. They're mainly to kind of guide you and keep you on track with moving forward with progress here. As well, and followed by the task, there'll be several change strategies or suggestions on how you can improve in this area, as well as references and additional reading. No, only one person from each hospital needs to complete the REDCap form. I'll take you into the REDCap system really quick so you can see it. Most of them are going to look exactly like this. This is the first one I'm going to ask you all to do over the next week, which is the environmental scan. the welcome packet or the module packet will be the first one you have listed. You can download it as a PDF, enter your information, answer the questions, and then submit it to me. Pretty straightforward, but as always, email me if you have any issues with it. And lastly, the virtual exercise. So this exercise is going to be conducted completely virtually, so sort of this manner. It's going to be led by one of our colleagues within the EGLE group. It's going to be a combined educational seminar and tabletop exercise on September 10th. So the educational seminar, you're going to facilitate conceptual understanding of sort of how new and improved systems and resources, how to address gaps within this care. And then our second part of the day will be the tabletop exercise. It'll have a pediatric COVID-19 focus, and we'll test the mobilization of resources within your local community in response to a disaster. So any questions here on the modules, the learning sessions, or the virtual exercise?
Hey, Meredith, this is Pat. I just wanted to, on the Red Cap survey where it's asking for the all hazards disaster plan, I just wanted to make sure that people understood what all hazards disaster plan was or is. You know, the Joint Commission and typically requires everybody to have an all hazard plan. So the answer to those questions is going to be pretty much yes all the time. And REVERT is really your comprehensive disaster plan for your hospital, as far as that, versus a specific plan for mass casualty or, you know, a certain type of hazard like hurricane or whatever. So that's really a reference to the hospital's, you know, comprehensive disaster plan in general.
Yes, thank you, Pat. Thank you for that. I really appreciate that. And I see a question in the chat box. The September 10th session is a full day. Yes, it's a full day and not a 1 hour session. But let me go over to my expectations. And we can start with this one in relation to that question. Do what you can. You know, we ask that you try to commit to participating in all of the collaborative activities. However, we get it. We all work in disaster. We are sensitive to the strain that the pandemic is placing on all of us. So, you know, there'll be no penalties for not attending the learning sessions or participating in the virtual exercise. We just ask that you do what you can. Anything is better than nothing. And let me just kind of continue here with our expectations, and really sort of the culture of this collaborative is all teach, all learn. So we have national subject matter experts who are here to share their knowledge and expertise with you. But we also strongly encourage you to share with each other. There are certainly things that you're doing that are unique that could definitely be used by other hospitals in this collaborative. So please share, but also with the air of respect. So this is a space where we can all come together and share these experiences without questions or fear of judgment, okay? So please be respectful of everyone, no matter their level of preparedness. We have rural hospitals all the way up to children's hospitals. And so there's going to be quite a range of experiences here. And lastly, turnover. We know that turnover is going to occur. If you can no longer participate in the collaborative, please let me know. And if possible, help identify maybe someone else at your hospital that can carry on the work. Any other questions on expectations, structure, the collaborative, how this is all going to work? Okay, well, let me go ahead and introduce quickly the environmental scan, which is your first task for the collaborative that we ask you to complete over the course of the next week. The link is here. You'll also be sent it here shortly. So as I mentioned earlier, there's two kind of motivations behind the environmental scan. And it's one to conduct a baseline assessment of your hospital's current state of preparedness as it relates to pediatrics. So how are they incorporated into your drill history or policies? And really, and then secondly, to inform us, the collaborative team, of the current disaster work ongoing in your institution so that we can ensure that the activities of this collaborative complement ongoing efforts at your hospital and are appropriately adjusted. So that being said, I don't want you to spend a lot of time digging up the answers. So it should be a quick run through the environmental scan. What are you aware of at your hospital? What do you know is going on? Because our next series of modules, we're going to take you through some of these elements that are in the environmental scan, and you're going to spend more time digging into them. So this is really just kind of give us a baseline understanding of where you're at, and then we can kind of move forward from there. So each hospital is going to receive a simple score on this environmental scan. Basically, you know, each yes is a point. I'm going to share the aggregate, not the individual scores, with the collaborative on our learning session next week, so we can get an understanding of where we're all starting. And then hopefully we will retake this at the end of the collaborative, and hopefully we will see strong improvement. The link to the environmental scan is down here at the bottom. It's also in the paper version of your welcome packet. There is a list of questions in the welcome packet too. So you can go ahead and complete those if you'd like to beforehand, before going into the system. This is for your reference only. I don't need the paper versions. I would prefer you please to complete it all via the REDCap system. And with that, I think that's sort of the summary of what we have for this first week, overview of the structure. And I wanted to leave plenty of time for questions. So can I answer any questions?
And Meredith, before questions, I just wanted to say, this is Brent again, you know, we're kind of in this together with you guys, and really we're just, you know, our key and our goal is to make you guys successful in this endeavor. And so really don't hesitate to reach out to myself or Meredith. I'm happy to field specific questions or concerns or anything, because we just really want to work with you guys on making this as successful as it can be for everybody involved.
Definitely. Thanks, Brent. Any other questions? Okay, well, with that, I want to thank
Meredith,
you guys again.
Sorry, Meredith, did you see in the chat box? So the letter of commitment has incorrect dates. It must have the old dates. So they
you know what? I did update that. I'll send a fresh one out to the group. I updated it a few days ago, but I'm not sure if you already received the link to the application. It may have the old one. I don't know if the system updates all of them. So I'll send a fresh one out to everyone. Okay, well, we should all have a good, yeah.
Meredith, I just wanted to invite the members here that, you know, there's a lot of information coming up kind of fast and furious with with COVID, and to, you know, link to the social media with the EMSC II, and also are invited to join social media for the National Pediatric Disaster Coalition. Social media is being heavily used to push out information, but you need to link to reliable sources. So, you know, maybe when you get off the call today, you know, just, look for the EMSC II social media icon in either Twitter or Facebook, and, link to that to, you know, just kind of get used to seeing what's out there and what's being pushed out in terms of reliable information for children.
Great suggestion, Pat. I'll send those links when I send the new letter of commitment too. Okay. If nobody has any more questions, you all have my email address, so please don't hesitate to reach out if you need anything from us. And we look forward to working with you all. So thanks so much.
Thanks so much, everybody.
Collaborative. You too.